Hi ladies and gentlemen, welcome back to BGS Clinics. From this video onwards, I will start a series on clinical assessment of swelling. In initial 3 videos, I will discuss clinical methods and diagnosis applicable to swelling in general, and later I will publish separate videos on specific swellings in various regions of the body such as the head, face, neck, breast, groin, scrotum, etc. By the way, what do you mean by swelling? Swelling is defined as an abnormal eminence. How is it different from edema? Edema leads to an abnormal eminence of the entire circumference of a region of the body, commonly a limb. This is the outline of case taking of a swelling. One clarification at the outset. I will discuss the clinical methods applicable to swelling alone. In actual clinical practice, however, you should do a comprehensive assessment as usual, which I have discussed in earlier videos on the principles of clinical case taking, history taking, general examination, and local examination. Never take shortcuts in clinical practice, lest you are bound to invite a trouble one day. Alright. In this class, I will talk on history taking and inspection of a swelling. Verify the exact duration of the swelling. Did it appear suddenly or else insidiously? How fast did it grow? A swelling of up to a week's duration, appearing suddenly and progressing over minutes, hours, or days, qualifies for acute swelling, whereas a swelling of more than 3 weeks duration, appearing usually insidiously and progressing over weeks, months, or years, qualifies for chronic swelling. Let us see how to obtain history in an acute swelling first. Any history of a bite, prick, or injury? Is it associated with pain? If so, how much is the intensity and what's the nature? Fever? Did the swelling regress in size? If it burst, did it discharge any pus, blood, etc.? Any history of disturbance of function of any organ, structure, or tissue? And these are the points to be asked in a chronic swelling. Has this swelling appeared for the first time or else it is recurrent? Did it regress any time during the course? Any discharge from the swelling? History of a prick or any injury in the past? You should persuade patients to try to remember this because some patients completely forget about any such event and then diagnosis may become tricky indeed. This patient presented with a painful swelling of many years' duration on the dorsum of right foot. Even on the repeated questioning, the patient denied past history of any prick or injury because he genuinely didn't remember. On examination, it appeared to be a chronic non-specific inflammatory swelling. X-rays of foot were normal. I took up the patient for exploration under anesthesia and see what was extracted. A 5 centimeter long retained thorn. History of pain. If so, did the pain start before or after the appearance of the swelling? In inflammation, pain begins before appearance of a swelling. What is the intensity of pain? What is the nature of pain? History of fever, disturbance of function of any organ, structure, or tissue, any other apparently similar swelling nearby or elsewhere. Well, it is beyond the scope of this class to discuss the interpretation of various answers given by the patients and inferences to draw therefrom. all that can be discussed during clinical case presentations. Anyway, now let us proceed with local examination. These all are the points to look at: number, site and extent, margin, shape, size, surface, skin overlying the swelling, color of the swelling, pulsations, and the surrounding area. Let us discuss them in detail. Describe the location of a swelling using proper anatomical terms. Note the extent in transverse and craniocaudal axis or in relation to anatomical landmarks in the vicinity. The site may help to fix the pathological diagnosis in some swellings which preferentially develop at specific sites. For example, carbuncles frequently develop on the nape of the neck, shoulder, and back. Cystic hygroma develops most commonly in the neck and axilla. Sebaceous cysts frequently develop on the face and back. Multiple sebaceous cysts tend to occur commonly on the scalp and scrotum. Congenital sequestration dermoid cyst occurs in the midline, at the outer or inner angle of the orbit, or behind the ear. Tuberculous lymphadenitis most commonly occurs in the neck. Other common sites in the descending order of occurrence are axilla and groin. Margin helps to determine the pathological nature of a swelling. On inspection, the margin of a swelling is determined with the help of the angle formed by the swelling with the surrounding skin. When it forms an obtuse angle, the margin appears ill-defined. Have a look at this swelling, a pyogenic abscess in the anterior abdominal wall. Note an obtuse angle between it and the surrounding skin. When it forms a right angle, the margin appears well defined. Have a look at this swelling. Note the angle between it and the surrounding skin. So this is a well-defined margin. Cysts and tumors situated in superficial tissue planes like skin, for example, usually have well-defined margin. When it forms an acute angle, the swelling is said to be pedunculated. In a pedunculated swelling, there is no need to mention the extent and the margin of the swelling. This was a pedunculated lipoma. The shape of a swelling or lump may help to determine the organ of origin as per the dictum. Even when enlarged, organs usually retain their shape. This is seen commonly in thyroid, liver, spleen, stomach, etc. Otherwise, the shape may also help to determine the pathological nature of a swelling. Cystic swellings and benign tumors usually have a regular shape, whereas malignant tumors are usually irregular. The size may give an idea about the pathological nature of a swelling, especially if it is big. Inflammatory swellings usually do not attain large size because they soften and burst, while cysts and tumors may attain large size. Have a look at a few big swellings. A big lump in abdomen. This was an ovarian cyst measuring 20 centimeters in diameter. A big benign tumor. This was a lipoma on the right thigh. It weighed 5 kg. This was a malignant tumor, right parotid. The surface may give an idea about the pathological nature of a swelling. The surface of a swelling may be smooth, lobular, nodular, irregular, etc. To the best of my knowledge so far, there is no clear consensus in the definition and interpretation of the so-called lobular and nodular surfaces. Anyway, by and large, the surface of cysts and benign tumors is smooth, though this is not a rule. This one in the scalp, this one on the nape of the neck. They were sebaceous cysts. And these were benign tumors. This one arising from submandibular salivary gland, and this one a lipoma on the right scapular region. A mass formed by multiple enlarged lymph nodes often has a nodular surface. The surface of malignant tumors may be irregular or nodular, though this is not a rule again. These are two masses of enlarged lymph nodes, imparting nodular surface to the swelling. This was a case of metastatic lymphadenopathy. This is a multinodular goiter. It is a benign condition. The surface of this swelling is irregular, so this must be a malignant tumor. A cauliflower appearance may be seen in ulcerated squamous celled carcinoma. Branching processes suggest papilloma. Is the skin overlying the swelling normal or otherwise? Skin overlying a swelling may be normal, but if it shows any of these abnormalities, then that will aid in the process of coming to diagnosis. Redness is seen in acute inflammatory swellings. These were acute pyogenic abscesses. This one was on the left shoulder and this one was perianal. This was a malignant tumor of cheek. Redness here was due to infiltration of the overlying skin. Sometimes redness may result from irritation due to local application of a medicine or fomentation. Surface capillaries suggest an underlying vascular malformation. This is a diffuse swelling affecting the dorsal and lateral aspects of right foot. A dull blue hue of the skin suggests an underlying vascular malformation. A black spot called punctum up on the swelling, if present, supports the diagnosis of sebaceous cyst. Edema of the overlying skin may develop in inflammatory or malignant swellings. This was a case of acute parotid abscess. Can you appreciate edema? Let us confirm. Pressure is being applied upon the swelling gently because it was painful and tender. Look at that pit. So that confirms edema. This is a classic orange peel appearance of skin overlying a swelling in the breast. This suggests infiltration of the skin by malignant tumor. Dilated veins are seen upon the surface of malignant tumors and vascular malformations. This was a malignant tumor. Ulceration of skin can result from various mechanisms. In malignant lesions, it results from infiltration or invasion, whatever you may call. This was a case of oral cancer fungating out. In big swellings, even benign ones, necrosis followed by ulceration may result either from pressure or stretching, thinning, and breaking down of skin. This is a big pedunculated lipoma on the left thigh. You can see a patch of necrosis here. On separation of this patch, an ulcer will become evident like this. By the way, a swelling, the overlying skin on which gets ulcerated, is called ulcerated swelling. In some specific chronic infections, ulceration results from necrotizing inflammation, for example, ulcer following tuberculous lymphadenitis. The pathology here is caseation necrosis. Sinuses are commonly seen in tuberculosis and actinomycosis. A scar may suggest recurrent swelling. Note the color and size of the scar. A recent scar is red, whereas a long-standing scar is either pale or hyperpigmented. A hairline scar suggests healing having occurred by first intention, whereas a broad and puckered scar suggests that healing must have occurred by second intention, which means that the wound got complicated by infection then. A specific color of the swelling may suggest the diagnosis. Any of these colors, if present, will aid in the process of coming to diagnosis. Black color suggests possibility of melanoma, a highly aggressive malignant tumor of the skin. Red or purple colored swelling could be an arteriovenous malformation, dermatofibroma, or dermatofibrosarcoma protuberans. Dermatofibroma can be yellowish brown as well. Blue or bluish color may be indicative of a deeper arteriovenous fistula. However, mucus cyst and ranula are also often blue or bluish. Rhabdomyosarcoma is basically a deep-seated tumor that presents when it projects into the skin as a reddish-brown swelling. Does the swelling appear to be pulsatile? The best way to notice pulsations is to observe the swelling tangentially. Pulsations are said to be expansile when the swelling expands equally in all radial directions. Such a swelling is called a truly pulsatile swelling, and the classic example is aneurysm. Sometimes a swelling may appear pulsatile if it overlies, that is, sits upon an artery. The swelling does not expand but instead moves only up and down along with pulsations of the underlying artery. Such pulsations are called transmitted pulsations, and they do not suggest aneurysm. Practically, however, it may not be always possible to differentiate between expansile and transmitted pulsations. If a suspicion of a vascular swelling is raised, it is safer to investigate anyway. How is the surrounding area? Cellulitis suggests infection. So-called satellite nodules or in-transit nodules may be seen in a case of malignant melanoma. So that's it on history taking and inspection of a swelling in general. I would like to thank Dr. Ashwin Apte and Dr. Ajay Jain, both consultant pediatric surgeons practicing in Bhopal, Madhya Pradesh, for providing photographs of their patients. Thank you for watching.